How is oxytocin best described in postpartum hemorrhage management? A. An antifibrinolytic adjunct given within 3 hours of hemorrhage. B. A prostaglandin used when oxytocin is unavailable. C. A second-line uterotonic that is contraindicated in hypertension. D. The first-line agent to prevent and treat postpartum hemorrhage. The correct answer is the first-line agent to prevent and treat postpartum hemorrhage. Oxytocin is the first-line agent to prevent and treat postpartum hemorrhage. Which condition most likely presents with a persistently reduced GFR with albuminuria? A. Latent tuberculosis infection. B. Chronic obstructive pulmonary disease. C. Asymptomatic bacteriuria in pregnancy. D. Chronic kidney disease. The correct answer is chronic kidney disease. A persistently reduced GFR with albuminuria is characteristic of chronic kidney disease. Which finding is characteristic of uterine rupture? A. Sudden abdominal pain with loss of fetal station and bradycardia. B. Failure to deliver the placenta within 30 minutes of birth. C. Absent variability with recurrent late decelerations or bradycardia. D. Slow cervical change before reaching 6 CNM dilation. The correct answer is sudden abdominal pain with loss of fetal station and bradycardia. Uterine rupture classically presents with sudden abdominal pain with loss of fetal station and bradycardia. Which newborn reflex is described by fanning of the toes when the sole of the foot is stroked? A. The palmar grasp reflex. B. The Babinski reflex. C. The stepping reflex. D. The sucking reflex. The correct answer is the Babinski reflex. Fanning of the toes when the sole of the foot is stroked describes the Babinski reflex. Which condition most likely presents with hip instability with a positive Ortolani or Barlow sign? A. Gastroschisis. B. Meconium aspiration syndrome. C. Physiologic jaundice. D. Developmental dysplasia of the hip. The correct answer is developmental dysplasia of the hip. Hip instability with a positive Ortolani or Barlow sign is characteristic of developmental dysplasia of the hip. What is the accepted value for the dilation that marks the onset of active labor? A. More than 5 contractions in 10 minutes. B. A baseline above 160 beats/min for 10 minutes. C. About 6 cm. D. Birth within 3 hours of labor onset. The correct answer is about 6 cm. The accepted value for the dilation that marks the onset of active labor is about 6 cm. Which test or tool best confirms postpartum endometritis? A. A postpartum hemoglobin and hematocrit. B. The Edinburgh Postnatal Depression Scale. C. A clinical diagnosis supported by cultures. D. Wound assessment and culture. The correct answer is a clinical diagnosis supported by cultures. Postpartum endometritis is best confirmed with a clinical diagnosis supported by cultures. A patient presents with a low temperature that raises oxygen and glucose demand. What is the priority action? A. Monitoring with phototherapy if levels rise. B. Therapeutic hypothermia. C. An oral airway with surgical repair. D. Skin-to-skin contact and a warm environment. The correct answer is skin-to-skin contact and a warm environment. With a low temperature that raises oxygen and glucose demand, the likely problem is neonatal hypothermia cold stress, and the priority is skin-to-skin contact and a warm environment. Which finding is characteristic of eclampsia? A. No cervical change for 4 hours with adequate contractions beyond 6 cm. B. A generalized tonic-clonic seizure in a preeclamptic patient. C. Painful vaginal bleeding with a rigid, tender uterus. D. New hypertension after 20 weeks without proteinuria or severe features. The correct answer is a generalized tonic-clonic seizure in a preeclamptic patient. Eclampsia classically presents with a generalized tonic-clonic seizure in a preeclamptic patient. The midwife suspects chronic obstructive pulmonary disease. Which diagnostic approach should be anticipated? A. An elevated TSH with a low free T4. B. A hemoglobin A1C or fasting glucose. C. Spirometry with a reduced FEV1 FEC ratio. D. Chest radiography. The correct answer is spirometry with a reduced FEV1 FEC ratio. Chronic obstructive pulmonary disease is evaluated with spirometry with a reduced FEV1 FEC ratio. Which condition most likely presents with cyclic cyanosis that is relieved by crying? A. Choanal atresia. B. Gastroschisis. C. Pathologic jaundice. D. An omphalosyl. The correct answer is choanal atresia. Cyclic cyanosis that is relieved by crying is characteristic of choanal atresia. Which test or tool best confirms pelvic organ prolapse? A. A pelvic exam using the POP-Q system. B. Darkfield microscopy with serologic testing. C. A clinical diagnosis. D. PCR or viral culture of a lesion. The correct answer is a pelvic exam using the POP-Q system. Pelvic organ prolapse is best confirmed with a pelvic exam using the POP-Q system. Which finding is characteristic of generalized anxiety disorder? A. Polyuria, polydipsia, and an elevated hemoglobin A1C. B. Dysuria, urinary urgency and frequency. C. A positive urine culture without urinary symptoms. D. Excessive worry most days for 6 months. The correct answer is excessive worry most days for 6 months. Generalized anxiety disorder classically presents with excessive worry most days for 6 months. The midwife suspects arrest of active labor. Which diagnostic approach should be anticipated? A. Leopold maneuvers confirmed by ultrasound. B. Continuous electronic fetal monitoring. C. Serial blood pressure with laboratory studies. D. Serial cervical examinations with contraction monitoring. The correct answer is serial cervical examinations with contraction monitoring. Arrest of active labor is evaluated with serial cervical examinations with contraction monitoring. The midwife suspects hypoxic-ischemic encephalopathy. Which diagnostic approach should be anticipated? A. Chest radiography with fluid in the fissures. B. A clinical exam with cord gases and imaging. C. The Finnegan scoring system. D. Serum bilirubin with a hemolysis workup. The correct answer is a clinical exam with cord gases and imaging. Hypoxic-ischemic encephalopathy is evaluated with a clinical exam with cord gases and imaging. The midwife suspects eclampsia. Which diagnostic approach should be anticipated? A. A clinical diagnosis in the setting of preeclampsia. B. A clinical diagnosis supported by ultrasound. C. Serial cervical examinations. D. Clinical criteria of fever plus supporting signs. The correct answer is a clinical diagnosis in the setting of preeclampsia. Eclampsia is evaluated with a clinical diagnosis in the setting of preeclampsia. The midwife suspects chronic kidney disease. Which diagnostic approach should be anticipated? A. A lipid panel. B. Chest radiography. C. The estimated GFR with urine albumin. D. A low serum B12 with elevated methylmalonic acid. The correct answer is the estimated GFR with urine albumin. Chronic kidney disease is evaluated with the estimated GFR with urine albumin. How is methylergonavine best described in postpartum hemorrhage management? A. A uterotonic for refractory atony that is contraindicated in asthma. B. An antifibrinolytic adjunct given within 3 hours of hemorrhage. C. A prostaglandin used when oxytocin is unavailable. D. A second-line uterotonic that is contraindicated in hypertension. The correct answer is a second-line uterotonic that is contraindicated in hypertension. Methylergonavine is a second-line uterotonic that is contraindicated in hypertension. Which test or tool best confirms transient tachypnea of the newborn? A. Hip ultrasonography. B. Chest radiography with fluid in the fissures. C. A clinical neurologic examination. D. Axillary temperature measurement. The correct answer is chest radiography with fluid in the fissures. Transient tachypnea of the newborn is best confirmed with chest radiography with fluid in the fissures. Which finding is characteristic of uterine tachysystole? A. Regular contractions with cervical change before 37 weeks. B. More than 5 contractions in 10 minutes averaged over 30 minutes. C. Leakage of fluid before 37 weeks without labor. D. Absent variability with recurrent late decelerations or bradycardia. The correct answer is more than 5 contractions in 10 minutes averaged over 30 minutes. Uterine tachysystole classically presents with more than 5 contractions in 10 minutes averaged over 30 minutes. Which condition most likely presents with spreading skin warmth, redness, and tenderness? A. Cellulitis. B. Allergic rhinitis. C. Chronic kidney disease. D. Hypothyroidism. The correct answer is cellulitis. Spreading skin warmth, redness, and tenderness is characteristic of cellulitis. Which finding is characteristic of congenital hypothyroidism? A. An adducted, internally rotated arm after a shoulder dystocia. B. Lethargy and poor feeding detected on newborn screening. C. A scalp swelling that does not cross suture lines. D. A boggy, spreading scalp swelling with signs of blood loss. The correct answer is lethargy and poor feeding detected on newborn screening. Congenital hypothyroidism classically presents with lethargy and poor feeding detected on newborn screening. The midwife suspects atrophic vaginitis. Which diagnostic approach should be anticipated? A. Pelvic ultrasound. B. Clinical criteria with supportive testing. C. A vulvar biopsy. D. A clinical examination. The correct answer is a clinical examination. Atrophic vaginitis is evaluated with a clinical examination. What is the schedule or key rule for the pneumococcal vaccine? A. A live vaccine that is contraindicated in pregnancy. B. Given each pregnancy at 27 to 36 weeks. C. Given routinely at ages 11 to 12 and through age 26. D. Recommended for all adults 65 and older. The correct answer is recommended for all adults 65 and older. The pneumococcal vaccine is recommended for all adults 65 and older. What is the mechanism or key feature of the copper intrauterine device? A. Thicken cervical mucus and require consistent daily timing. B. Create a spermicidal inflammatory environment without hormones. C. Delay ovulation as emergency contraception for up to 5 days. D. Thicken mucus and thin the endometrium to reduce bleeding. The correct answer is create a spermicidal inflammatory environment without hormones. The copper intrauterine device create a spermicidal inflammatory environment without hormones. The midwife suspects pathologic jaundice. Which diagnostic approach should be anticipated? A. Failure to pass a catheter through the nares. B. Axillary temperature measurement. C. A clinical neurologic examination. D. Serum bilirubin with a hemolysis workup. The correct answer is serum bilirubin with a hemolysis workup. Pathologic jaundice is evaluated with serum bilirubin with a hemolysis workup. The midwife suspects transient tachypnea of the newborn. Which diagnostic approach should be anticipated? A. Chest radiography with fluid in the fissures. B. A conjunctival culture. C. The Finnegan scoring system. D. Serial head circumference with hematocrit. The correct answer is chest radiography with fluid in the fissures. Transient tachypnea of the newborn is evaluated with chest radiography with fluid in the fissures. Which fetal heart rate pattern results from an abrupt fall lasting 2 to 10 minutes? A. Early decelerations. B. Prolonged decelerations. C. Late decelerations. D. Variable decelerations. The correct answer is prolonged decelerations. An abrupt fall lasting 2 to 10 minutes produces prolonged decelerations. What is the priority management of a cesarean wound infection? A. Antibiotics with possible incision and drainage. B. Fundal massage followed by oxytocin. C. Uterotonics with evaluation for retained tissue or infection. D. Beta blockers for symptoms then thyroid monitoring. The correct answer is antibiotics with possible incision and drainage. The priority for a cesarean wound infection is antibiotics with possible incision and drainage. Which test or tool best confirms secondary postpartum hemorrhage? A. An urgent psychiatric evaluation. B. Ultrasound with clinical evaluation. C. Pituitary hormone testing. D. Bimanual examination with ultrasound. The correct answer is ultrasound with clinical evaluation. Secondary postpartum hemorrhage is best confirmed with ultrasound with clinical evaluation. How many did you get right? Let us know in the comments, and tell us what topics you want us to cover next. Want to practice more? Download the app and get hundreds of free practice questions with detailed explanations.